Hello, Mr. Smith. My name is Jessie. I'm one of the nurse practitioner students here, and I'm going to perform a head-to-toe physical assessment on you today. I'm starting with my general survey. The patient's a 31-year-old, well-appearing male who's dressed appropriately, well-groomed, and I don't note any signs of distress. You know where you are?
At the doctor's office.
What's your name?
Rob Smith.
And what year is it?
2019.
So the patient is calm and has a bright affect. He is alert and oriented, and we will move on to our skin. Let me talk to you about his vital signs. So his height was 75 inches, 341 pounds, 42.6 for a BMI, 98 for a temperature, 72 for a heart rate, 128/88 for a blood pressure, and his respiratory rate 16. Other than the elevated BMI, there were nothing out of the ordinary. So moving on to our skin assessment, the patient's pink, warm, and dry, and I don't note any skin lesions or any problems there. I'm deferring my scalp assessment till further in the head and face assessment. So I'm visualizing the head and the face for symmetry and any kinds of deformities. Mr. Smith, I'm going to palpate your scalp, and if you have any tenderness, let me know. And I'm noting that the hair is well distributed and normal texture, and I don't note any scalp lesions. I'm palpating the temporal pulses for any thrills or bruits, and I don't note any. Are you having any pain in this joint?
No.
Okay, and then can you clench your jaw? All right, and so I'm checking to make sure that the masseter muscles are strong, and they are. And then we'll move on to the cranial nerve assessment. So can you smile, puff your cheeks, and raise your eyebrows? All right, and then I'm going to touch your face in several different spots. If you'll just tell me if you feel sharp or dull sensation. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
All right. And then I'm going to touch your face. If you'll just tell me if you feel the same sensation on both sides.
Yes. Yes.
Feel the same?
Yes.
All right. So that was a normal assessment. Moving on to the eyes, we'll use the Snellen chart to assess visual acuity. Can you cover your left eye? And can you see this line?
FELOPZD.
This one?
DEFPOTEC. No clue.
Okay. And then if you'll cover the other eye. So that was 20/25 in the right eye. And then can you see this line?
DEFPOTEC. No.
Okay, and that's 20/25 in the right eye. Wait, in the left eye? Was that the left eye we just done? Okay. And then can you see this line again with both eyes?
DEFPOTEC. No idea.
Okay, and so that's 20/25 overall. We'll do the finger wiggle test. If you will cover one eye and look straight at my eye with the other one. Can you see my finger in your peripheral vision? All right. And then we'll do the other one. Can you see my finger in your peripheral vision?
Yes.
Okay. And so Mr. Smith has really good peripheral vision. Normally you'd have to move your finger in towards them to see their peripheral vision. So 6 cardinal fields. Mr. Smith, if you'll just stare straight at my finger and follow it with your eyes. And I'm looking for any asymmetrical movement, nystagmus, and I don't appreciate any at this time. I'm noting the pupil size and symmetry. So they're round and about 4 millimeters, and they're symmetrical. And I'm going to use my ophthalmoscope. I'm going to check your pupillary response if you'll just stare straight ahead. And so these pupils are round and reactive to light. There's a consensual response, and then if you'll just stare straight at my finger. And he does have an accommodation response. I'm going to assess the conjunctiva, sclera, iris, and cornea. I don't note any deformities there, no drainage, anything like that. I'm going to use the ophthalmoscope to check for a red light reflex and it's present. I'll assess the internal structures. Moving on to the ears, I'm examining the external auricles. We're going to do the whisper test. If you'll take one finger, rub it over your, and then I'll whisper a phrase and you'll repeat it back to me.
1, 2, 3.
All right, and then we'll switch ears.
1, 2, 3.
All right, moving on to the Weber test. I'm going to put this on the top of your head. You'll be able to hear a sound if you'll just tell me you can hear it in both ears, or if you can't.
Yes.
All right, and then we're going to do the Ryan test. I'm going to put this here. You'll tell me when you stop hearing it. We'll put it here, and you can tell me when you stop hearing it again.
Okay. Okay.
All right, and for the sake of time, we'll repeat that in the other ear after the video. I'm going to look with the otoscope. I am able to visualize a pearly gray tympanic membrane with a 5 o'clock light reflex in that right ear, and a pearly gray intact tympanic membrane with a 7 o'clock light reflex in the left ear. I'm going to inspect the external nares for patency, and those look patent. I'm going to look inside the nose with my otoscope, inspecting the nares, the nasal mucosa and the turbinates. Those are pale and boggy, but it's sinus season, so that's expected. I'm going to palpate the frontal and the maxillary sinuses. Are you having any pain or tenderness there? No. Okay. And then I'm going to put on my gloves, and we're going to inspect the mouth. We're inspecting the lips. The lips, the gums, teeth, tongue, and oral mucosa. The oral mucosa is pink and moist. I've assessed the patient's vocal quality. Can you swallow for me? All right, and that was a normal response. I'm going to look in your throat. I'm noting the position of the uvula and that the throat is pink. There is a little bit of postnasal drainage. And other than that, the tonsils look normal, and I didn't note any swelling. Stick out your tongue for me. And I'm looking for symmetry, any fasciculations, and I don't note any. So, Mr. Smith, can you touch your chin to your chest? All right, and can you extend your neck back, ear to ear? And then can you rotate your neck in a circle? All right, I'm going to palpate the lymph nodes, the preauricular, postauricular, the occipital, the posterior cervical chain, the superficial cervical chain, the submandibular, the tonsillary, and then the submental, as well as the supraclavicular. And then I'm going to assess the, I forgot your thyroid, sorry. So standing behind the patient, I'm going to palpate the thyroid. I don't note any enlargement. Can you swallow for me? And I didn't appreciate any nodules there. We're going to raise this arm here, and I'm going to feel for the pectoral lymph nodes, the axillary lymph nodes, the central lymph node bundle, the lateral lymph nodes, and then the subscapular lymph nodes. And we'll do that again on this side. Just bend your elbow. All right. And so I'll palpate the sternoclavicular area, the acromioclavicular and the subacromial areas. Did you feel any pain or tenderness there? We'll do range of motion of the shoulder. If I could get you just to put your arms down by your side and raise them directly over your head like this. And then if I could get you to go as far back as you can. And then if you could pull one arm over each shoulder, or just lift your arm up. There you go. I'm going to palpate the elbows, checking for any deformities. I'm also checking the epitrochlear lymph node. Any tenderness there? And then we're going to do range of motion in these elbows. I'm going to assess pulses in the radial arteries. And I'm going to give those 3+, and then I'm palpating the brachioradialis. And those are 2+. And can you squeeze my hands? All right, and I'm going to give them a 5 out of 5 strength there. I'm moving on to the chest. I'm noting any asymmetrical movements, which I don't see any. I also am making note that the AP and lateral diameter is 2 to 1. I'm going to palpate the carotid arteries on each side. And I'm going to give those 2+. I'm going to auscultate those on each side. I'm going to auscultate heart sounds in the aortic position. The pulmonic. The tricuspid. And the mitral valve area. The heart rhythm is normal. The rate is 72. The point of maximum impulse is about 6 centimeters from the left sternal border. I'm going to assess lung sounds anteriorly. Maybe you'll just take some deep breaths for me. All right. I'm going to move on to the posterior chest. I'm going to put my hand in several different areas. If every time you feel me touch your back, if you'll just say 99.
99, 99, 99, 99, 99, 99.
All right, and that was tactile firmitis. And then I'm going to percuss in 6 different areas. And I noted some resonance, but no hyperresonance or dullness. We're going to do egophony now. If you will, every time my stethoscope hits your back, if you'll just make an E sound and hold that out.
E, 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 E.
All right. Oh, I'm bronchophony, sorry. If you will just, whenever my stethoscope hits your back, if you'll just say 99.
99, 99, 99, 99.
All right. All right, so we're going to move to you laying on the couch. And I'm moving on to the abdomen. So I'm inspecting the abdomen for any striae, scars, hernias, any pulsations, masses, anything like that. and then the contour as well. I'm going to listen to vowel sounds in all 4 quadrants. And those are normal. I'm going to listen to vascular sounds also in the aorta, the renal, the iliac, and then the femoral. And I didn't note any extra sounds there, no bruits or anything like that. We're going to percuss in 4 quadrants. All right. We're going to percuss the liver span. I would start down low in the right quadrant, making note of where the liver, the lower level of the liver is, and then start mid-clavicular in the intercostal spaces here. And I would note the top span of the liver. Move over to the left side for the spleen. And I don't note any dullness that indicates splenomegaly. We're going to palpate the 4 quadrants of the abdomen. We'll palpate the aorta to measure size there, and then we'll use light palpation. Any tenderness, Mr. Smith?
No.
And then we'll use deep palpation. Any tenderness?
No.
Okay. And then I'm going to push down, and if you'll pay special attention when I let go, let me know if you have any increased tenderness.
No.
All right. Moving on to psoas sign. Mr. Smith, I'm going to put some pressure on you right here. If you could lift your leg against my resistance. All right. And did you note any increase in pain in your right lower?
No.
Okay. And then obturator sign, if you'll bend this over, and I'm going to push here, and if you can lift your leg. Any tenderness in your right lower?
No.
All right. Moving on to the genitourinary. I'm going to palpate the urinary bladder for any distension, and I don't note any. I'll go ahead and percuss. Dullness would indicate a full bladder, but I did not appreciate any. We are going to, if you'll sit up for just 1 second, I'm going to palpate. Are you having any tenderness here?
No.
Okay, and that's the costovertebral angle, and you can lay back down. Okay. We're going to defer the rest of our genitourinary and rectal exams. We're going to start with our inspection of the hips. I'm inspecting for any edema, any redness, swelling, any deformities, and I don't appreciate any. I'm going to palpate for any deformities or tenderness. Are you having any here?
No.
Okay. And then we're going to test the range of motion in each hip. And so we're going to lift your hip there. And then that looks good. All right. While the knee is in flexion, I'm going to palpate above, below, and to each side of the knee for any swelling, and I don't appreciate any. And we'll do the same thing over here. Any tenderness there?
No.
All right, and then we'll do range of motion in these knees. All right, looks good. We will perform the anterior drawer test. And so with the patient's leg flexed, I will pull, and I didn't note any give there that would indicate the ACL being, I'm going to palpate pulses, beginning with the femoral pulses. And those are 2+ bilaterally. The popliteal pulses, also 2+ bilaterally. The pedal pulses, I'm going to give those a 1+. And the posterior tibial pulses of 1+ as well. We're going to do ankles and feet range of motion. And I don't note any limitations there. Can you feel me touch?
Yes.
All right. And is it the same on both sides?
Yes.
Can you push against my hands? And can you pull back against my hands? So I'm going to give him a 5 out of 5 there. All right. If you will have a seat back in the chair, moving on to our neuro exam. I'm going to test the bicep reflex. That's okay, just relax your arm there. Okay. I'm going to test the, you can just relax your arm. I'm going to test the triceps reflex. And we'll do the same over here. All right. And then we'll do the brachial reflexes. All right. And then the patellar reflexes. If you'll just relax your leg here. All right. All right. And then we'll do the Achilles. All right. And then the Babinski. We will do some rapid alternating movements. So if you'll put your hands on your knees and alternate just like that, that looks good. And then we're going to do a point-to-point test. So if you'll take one heel, place it just below your kneecap, and then run it all the way down the front of your leg there. Looks good. I'm going to place a familiar object in your hand. If you'll close your eyes, tell me if you can figure out what that is.
It's a quarter.
And we'll put something in this hand.
It's a quarter.
Okay. And so that was stereognosis. And then if you'll stand up, we're going to assess the range of motion in the spine. If you'll bend forward and then back as far as you can go. All right. And then side to side. All right. And so there was good spinal range of motion. And then we're going to assess your gait. So if you'll take several steps towards me, just normal walking, okay? And then if you'll take several steps with your heel to your toe. All right, and the patient's able to do that with ease. And now we're going to do a test called pronator drift. If you'll close your eyes, raise your arms, palmar surfaces up, and I'll count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and I didn't note any drifts, so that was good strength. And then we're going to perform the Romberg test. So if you will close your eyes, stare up at the ceiling, and put your arm straight forward. All right, and I didn't note that the patient lost his balance or anything like that. And that concludes our head-to-toe physical assessment. Thank you for your time. Uh-oh, I don't know how to.
Was it locked?